time, if ever. Phase 3. We help them explore the meaning of apology and forgiveness, give them the opportunity to engage in both, and set the stage for them to support each other in healing emotional wounds that predate their relationship. The third section explains how patterns of autonomic reactivity underlie the compulsive behaviors at the core of a couple's relational dynamics and illustrates how to discuss these phenomena with couples. Finally, the book's fourth section describes some common challenges for couple therapists, while the fifth section provides additional experiential exercises so partners can rescript and repair conflictual interactions. Because the IFIO approach is best grasped experientially, we recommend that therapists try these exercises personally before using them with clients. Try them with a partner, friend, or colleague. Alternatively, try them in your mind's eye with your own polarized parts, with someone you know, or with a couple you find manageable. Section 1. Basic Concepts. Parts. Intimacy from the inside out, IFIO, is built on the conceptual foundations of internal family systems, IFS, a therapy developed by Richard C. Swartz that endorses the normality of psychic multiplicity and engages the plural mind. IFS applies the systems thinking of family therapy to individual, couple, and group therapy. The basic premise of IFS is that we all have what Swartz calls parts, as illustrated in common thoughts like, one part of me wants to go to the party, another part wants to stay home. Parts manifest in a developmental sequence throughout life, with their own personalities, temperaments, and a full range of feelings. We can notice the feelings, thoughts, and sensations of our parts, and we can talk to our parts. If we ask about their motives, they generally answer. Most vitally, regardless of their behavior, our parts want for us what we want: connection, validation, and love. Like people, parts live in an inner community, where they develop alliances and get into conflicts. When this community's most vulnerable members feel scared, unlovable, or ashamed, other parts take on protective roles and try vigorously to do two things: banish the wounded part, the exile, from awareness, and ensure that the injury never happens again. We call proactive protectors managers and reactive protectors firefighters. Managers are the parts who focus on maintaining social connections and aim to conceal qualities they associate with weakness or badness. Their main tool is inhibition, which comes in many forms, including symptoms of mental distress, like dissociation or denial, self-directed criticism, warnings or threats, and bleak views of possibility. Looking for relief from emotional pain, reactive protectors respond to all this inhibition with rebellion and disinhibition. Provided their strategy works quickly, these parts don't concern themselves with consequences. Popular firefighter options include substance use, eating disorders, pornography, promiscuity, and other high-risk, high-engagement behaviors that offer good distraction. Although some inhibit and some disinhibit, all protectors aim to keep emotional pain out of awareness and don't understand that banishing vulnerable parts increases their panic and pain. When exiled parts panic and manage to break into awareness, protectors simply double down on excluding them. This repetitive, draining dynamic consumes a great deal of mental and emotional energy. Life does not have to be a ping-pong match between inhibition and disinhibition. In addition to parts, we all have an inborn font of compassion, spacious awareness, and wisdom, a seat of consciousness, of which most clients are not much aware, the self. To fashion secure, stable attachment inside and out,